to this last webinar of the year for the Drexel Climate Change and Urban Health Research Center and the SALURBAL-Climate project. Before we start, I wanted to mention an activity that the Drexel Climate Change and Urban Health Research Center is doing in September of this year, sorry. In a few months, we are doing a symposium on climate change and urban health, a focus on the future. This is a free event where we'll have two panels focusing on the on methods and new data for climate change and urban health research, and another panel focused on policy and what do policymakers need in terms of evidence from us. If you are interested in registering, you can find a QR link on the page here. And again, it's going to be a free event, both in person here in Philadelphia and also will be live stream virtual. So please register if you are interested. Okay, so today we are having, as I said, the last webinar of the year. We have Juan Castillo from Juan José Castillo from the Pan American Health Organization, PAHO. He's a regional air quality advisor. He works delivering technical cooperation to health officers in the Americas and in the Caribbean to build capacities towards addressing the air pollution burden of disease. Juan has 14 years of experience, more than 14 years of experience in the environmental public health field. He has worked as an executive director in international nonprofit organizations and as a public officer in transport, environment, and health. He has working experience in the private sector too. Juan leads the development of the RQ Plus regional expert group from Latin America and the Caribbean, which is a working group with over 100 experts from more than 15 countries, fostering the use of RQ Plus to support the decision-making process in the region. So Juan José will be presenting today about advancing integrated action on health, climate, and air quality, an overview of the Pan American Health Organization city-level technical cooperation. Just a few reminders. So interpretation to Spanish and Portuguese is available. If you want to hear the talk in Spanish or Portuguese, you can go to the little world icon at the bottom and just click on whichever language is your preferred one. And also, if you have any question, please type them in the Q&A section of Zoom. And at the end of the talk, I'll be facilitating the questions and answers part. So, Caleb, we can stop sharing, and we'll let Juan José share his screen. Thank you, Juan José. Okay.
Thank you, Usama and Kayla. Thank you, everyone, for joining. So excited to see so many familiar faces over here. Thank you, Jose Luis, Diana, Dr. Olga Lucia, for joining this session. For us, it is always a pleasure to work together with you guys. My name is Juan Castillo, Air Quality and Health Advisor of the Pan American Health Organization, as discussed. I'm very excited about this invitation. We believe in the power of partnerships, especially having this partnership with academia. Astrid, good to see you as well. Having this partnership with academia and the opportunity to exchange experiences. Well, I keep greeting because I also see Thomas Gotchi connected. Well, and if I'm missing someone, I apologize. But we're really excited about this conversation today. So we wanted to outline or give a wide overview of what we are doing to advance integrated action on health, climate, and air quality, particularly at city-level technical cooperation. Traditionally, our technical cooperation has been really focused on national level because our focal points and counterparts are usually at the Ministers of Health, at the Ministry of Health. Said that, when we are trying to tackle, you need to put together some national and subnational efforts in order to advance a more comprehensive response to environmental health threats. At national level, you probably can develop policies and regulations, but then and of course advance like sustainability strategies for energy and transportation, as well as mobilize some funding. However, the implementation in most of the countries of those measurements, of those interventions, relies on at city level. So we understand that cities are like the most important public health space, and that is where we are also trying to develop and implement technical cooperation at a city level in coordination with our regular focal points at the national level. Well, we are aware that we are facing a triple planetary crisis that includes climate change, pollution, and biodiversity losses. But then the burden of disease of what we know about the burden of disease, about environmental risk factors in the Americas, is that at least 1 million premature deaths per year are attributable to environmental risk. But we want to be fully transparent on this data, because this data is from 2010, is the last estimate that we have. So we have over a decade without data consolidating this information in the Americas. Official regional consolidated data. So this is also something that WHO is working in to update, but wanted to highlight as well that the burden of disease over low and middle income countries is higher than those in high income countries for several reasons, but also highlight that this number might be a misrepresentation or an underestimation of what is the current burden of disease, the current issues in the region. Because when we are talking about the environmental risk factors over the health, the environmental risk factors that can affect health, we have air pollution that is linked to approximately 250,000 premature deaths in the Americas, Latin America, and the Caribbean. But we also have some other risk factors where we don't have proper mortality estimate, like is the inadequate solid waste management, exposure to hazardous chemicals. And when we are talking about water, sanitation, and hygiene, over 90 million people in the region don't have access to basic drinking water services, and more than 84 million still doesn't have access to sanitation services. And more critically, in a more like critical component, 13 million people still practice open defecation in the region. So it's like we heard this before, that the Americas is probably one of the most inequitable regions in the world. And when we see the data, there is a lot of reasons to where we can see there is a lot of data that is backing up that. But of course, I'm also going to take a few minutes from, actually, I'm going to focus the conversation on air pollution and climate change, being the air quality advisor. So we know that air pollution is a global threat. Usually when we are talking about air pollution, we focus our attention on Southeast Asia and Africa, and there are very important reasons to do that. But the Americas is in a point where they can advance to achieve it's like a turning point, or like a pivotal point. We can either move forward to advance to cleaner air quality conditions, like in Europe or and North America, or we can derail and go back to a more polluted scenarios. So we are excited about the work that is being done in America, because we have seen progress in the region during the last few years, and also like a more articulate response when we see what are the common health challenges in America. The air pollution is a common health challenge for the Americas. More than 370,000 deaths are attributable to air pollution in the region. This accounts for both ambient and household air pollution. It's probably one of the largest environmental health threats in the Americas. However, I'm listening the same, I'm hearing the same sentence for all the risk factors. So probably it's just one of them. But I wanted to highlight, to point out your attention to a couple of data here. So what we know, this is based on World Bank and IDB estimation, is that externalities attributable to air pollution are around 2 to 4% of GDP in developing countries. Our region grows at the best at 6%, countries in the region 6-7%. So if we were able to estimate the externalities or to account the externalities of air pollution and other environmental risk factors in the region, we will be aware that we are actually limiting the capacity and the growth in our countries in the region. More important, over 250 million people in the America live in areas where WHO air quality guidelines are exceeded, and we are talking specifically of cities that are monitoring air quality that are over 500,000 inhabitants. But we have a lack of information in the region. You can see on the map on the right that was developed also in collaboration with the National Institute of Public Health of Mexico. The purple X's are like cities of more than 500,000 inhabitants or capital cities that don't have air quality monitoring using reference grade stations. So there is a lack of information in the region. Furthermore, and we have this here, like over 150 million living cities with no air quality data. But this is specifically for 500,000 cities of 500,000 inhabitants. That it's a number that we are using just because that is a city size where we are seeing that there are capacities to start doing air quality monitoring. But as it has been discussed before in other scenarios, air pollution doesn't affect only medium to large size cities, and there are very particular conditions. Air pollution is a local issue as well that can affect air pollution, the concentration of air pollutants in a specific location. So our overall message here is that the problem might be bigger than what we are accounting at this time. There are some driving forces in the region. There are commons. We have our important reliance on polluting fuel for transportation and energy production. We have an aged public transport fleet, even though there are important efforts to advance towards electric or cleaner mobility alternatives. We have a rapidly growing motorization rates, and we are using polluting fuel for transport and energy. Particularly, we still in the region in certain countries have diesel and fuel with high sulfur contents. And then we are starting to address other topics that were traditionally not addressed when we are talking about air quality. So traditionally we're focusing in industry and urban transport, but then we are seeing some action in maritime emissions, poor land use, as well as reliance on solid fuels and biomass for cooking and heating, wildland, forest fires, and oil and gas, and emissions from the oil and gas industry. When we have a look at that mortality that we are talking about, we can see this is coming from the from the Global Health Observatory. So for the Americas, around 80% of the mortality attributable to air pollution is linked to non-communicable diseases. So chronic COPD, lower respiratory infections, trachea, bronchus, lung cancers, ischemic heart disease, and stroke. So, and lower respiratory infection as a communicable disease. So it is very important to have an articulated effort with the non-communicable diseases community. And at PAHO and WHO, we are trying to advance on that regard. Actually, air pollution is one of the risk factors for non-communicable diseases as part of this 5x5 matrix that is considered for the NCD Alliance. But traditionally, most of the work on the non-communicable diseases community has been focused on unhealthy diet, tobacco, use of alcohol, as well as physical inactivity. So we are starting to work on integrating air pollution as part of this response, while also articulating with other co-benefits or an integrated response with other risk factors. What the evidence is telling us is that almost every organ is affected by exposure to air pollution, not just because of the size of the particle, the type of the pollutant that we are assessing, but also particulate matter can also carry certain chemical substances and metals that can increase the toxicity of the particle. When we are doing the burden of disease or the Global Health Observatory, we are not specifying what is the toxicity of the particular matter. However, there are new studies that are trying to address what are the sources of pollution, what are the speciation of particular matter, and what could be potentially the increased risk over the population. And air pollution is not the same for everyone. We know that because of through our life course, even because of socioeconomic conditions, like people relying on polluting fuel for cooking and heating, or people working on outdoor environments can be more exposed to air pollution, but as well when the children, the pregnant women, and the elderly people can have are more vulnerable or are in an increased condition of vulnerability against air pollution. And that is also a point with a connection point with climate change. Uh, First, we share emission sources. Most of the actions to reduce greenhouse gases have potential benefits on climate, on air pollution, on improving air quality. But also when we look at the vulnerability groups and the climate sensitive health risk, some of them or most of them are also related with air pollution, such as non-communicable diseases, respiratory illnesses, mental and psychosocial health. So it's very important to have this articulated response, particularly in a scenario where most of the funding and planning is responding to climate change risks. So that is what we are trying to consider as part of PAHO response. So PAHO has the technical cooperation agenda on health, environment, and climate change that is trying to put equity at the heart of environmental public health. So particularly the air quality and health program include these 5 working areas that are regulation and governance, planning and evaluation tools, surveillance and information systems, primary care and health response, outreach and capacity building, and we work on ambient air pollution, household air pollution, and indoor environmental quality, with the goal to achieve a reduced air pollution burden of disease. I would like to particularly today we're going to talk a little bit more about the health co-benefit assessment tools and the work that we are doing at cities. I have a couple of slides in Spanish, but we wanted to say that local governments have a huge influence over public health. People live, work, study in the territory, like in the cities, in the municipalities. So whatever the governments are doing have a very important influence on not just the life quality, of course, but also the health of the population. So also the urban areas, local areas is a great scenario to encourage social participation, intersectorial work, and social innovation. So we are putting here some of the things that happen at the local, where the local government has influence in social development, schools, participation, culture, transport, and those policies over urban design have a health impact. And this is probably for this community has been discussed widely, but what we have found out is like policymakers or urban designers, the units of urban design and the city mayors and even the health sector is not always aware or tend to believe that they have limited capacities to do this intervention that can address health impacts, or that their intervention that they are planning can be enhanced by incorporating these health considerations. So the way how a city is designed um, can affect how people behave, right? Walking, cycling, driving, public transportation, and those behavior can have can affect pathways that, for instance, in the case of air pollution or exposure to UV radiation can affect health outcomes and also can have an effect on mortality. So we have seen like very walkable cities, but we, for instance, we are trying to promote, and I know that there is a lot of work on this group on this, on cycling and walking, active mobility. But that is not just a matter of having bike designated bike lane areas or doing peatonalization, but you need to have also a transformation of the environment, because last week we were working on the week of road safety, the road safety week. And when we notice it, like it's very important to offer safe roads if we want to have to increase active mobility, because otherwise it's going to be a huge disincentive for people to do that, even though you have a benefit. But if the risk is that people can die because there is no safe road conditions, so it's very difficult to advance on that. But if we are able to plan cities in a way that we can encourage a more sustainable behavior, if we couple these interventions with the development of green urban areas, arborization, also stations for, and we develop this intervention not just in areas where the rich people or the high income people can have access to it, but also considering middle and low income areas that could increase the health benefits of those interventions. So how are we using health impact assessment tools? We're using these tools to estimate the health impacts of air pollution and climate change, to promote joint work among the health and environmental sector and the intersectorial articulation, because we have, again, it seems natural that the health and environmental groups should work together, but that usually doesn't happen, even though there are environmental health units in health secretariats most of the time. But when we use the health impact assessment, we are able to put together the efforts from the health sector, or data from the health sector and data from the environmental sector, so they are called to work together. And it has been such a powerful tool. And I will say that is part of the thing that this tool has helped us the most to enhance governance, to enhance technical cooperation and articulated work. Of course, intersectoral articulation, but because this is not just a matter of health and environment, but also other sectors. Regulatory development, evidence for action, and strengthen epidemiological surveillance or surveillance of health outcomes. Because other thing that we have noticed is like everyone wants to estimate the health benefits when they want to develop an intervention and mobilize resources, but then there are not monitoring systems in place that allow us to track the health benefits of those interventions. So we use it as an argument to mobilize resources, to showcase what are the benefits of certain interventions or certain public policy, but then we not all the time the mechanisms to monitor those benefits are in place. So it's very important to work on that as well. And also we are using these tools to promote specific policies as access to clean household energy and to work on capacity building. Here is an overview of these tools. We of course have their quality standards or their quality guidelines actually, and tools such as Climate QH or Carbon Age, RQ Plus, that Climate QH that talks about the benefits of greenhouse gases mitigations, the health benefits of greenhouse gas mitigation, RQ Plus about the health benefits of air quality, Green UR, CHEST, that is a tool to support policy making and estimate benefits on household air pollution or clean household energy. Heat, that is the one talking about active mobility. I did mention that Green UR is about green urban areas, and we are also working on a regional expert group of users that can help us to implement those tools. So RQ Plus is a software tool developed by WHO that help us to estimate the air pollution burden of disease, and the impacts of air pollution include both long-term and short-term exposures. And I would like to say, like, these tools that we are going to discuss exist, that they are free. However, WHO PAHO, several of you guys are making a huge investment on developing capacities for cities to be able to use the tools. So, and we think that that is part also core of the work that needs to be done. These tools are designed to be used by the cities, by at a local and national level, hopefully without needing to have WHO or PAHO or a certain expert or consultant to do this work. But of course, there is a learning curve, but the idea that the cities and government can use this and the academia. So we did this work in Trinidad and Tobago when we supported the preparation of a roadmap on air quality, short-lived climate pollutant mitigation, and health. And I'm sharing the partners here because this require an intersectorial effort. So we have all the health authorities participating in this, in this process. So we have the regional health authorities. Let me see if I can zoom in. Okay, we cannot. We have the regional health authorities. That is like there are four health authorities in Trinidad and Tobago. We have the Environmental Management Authority. We have the University of West Indies supporting the work, as well as the National Institute of Public Health. And this project was developed in cooperation with the UNEP and the Climate and Cleaner Coalition and PAHO. So it helped us to put together a lot of effort, a lot of stakeholders. So we were able to actually capture what were the country priorities and help them to articulate to regional and global policies. For the phase 2 of that project, and I'm mentioning this to highlight the importance of articulating national and local program. So we say, okay, we're going to develop a national level action plan or roadmap, but then we're going to work with cities to implement those interventions and to identify what will be the best buys at a city level. So we engage with city level representatives to implement health impact assessment tools such as HEAT and Green UR, identify strategies to reduce emissions, to protect health, and integrate principles of healthy municipalities, the principle of healthy municipalities, cities, and communities movement, as well as fostering high-level political commitment. So we did some workshops, we use the tools to do that. So the tool gives you a number that we're going to see some numbers in a few slides, but also is helping us to develop these processes of stakeholder engagement, of policy making, and trying to advance on governance as well. So we have put together this regional expert group that the National Public Institute, the National Institute of Public Health Mexico is helping us is having the technical secretary to increase sustainability on the use of RQ Plus and other health impact assessment tools in the regions. So we want at least to have more than 120 cities during the next 5 years using the tools by themselves, or it doesn't need to be the technical officer that is doing that is using the tool. It can be in partnership with a university. It can be whatever is the arrangement that works the best for the city that works perfectly for them, right? So we have over 100 during 2023, 2024. We have an in-person workshop in Barranquilla with more than 40 national experts from 12 countries. And we have been working with them also on an action plan, and each country and cities are developing action plans to use the tools. And we are mentioning this because we wanted to, sometimes talk about democratizing the knowledge. So our idea here was like that. We want to increase regional capacities by empowering cities and countries to use that. And the tool can be used on strengthen the capacity. So what are the countries and participants doing now is also strengthening capacities to use environmental impact, health impact assessment, using those data to support public policy, and also contributing to integrate climate change, air quality, and health action. So here are some pictures of the world of 2023, 2024, the trainer session that we held during those years. And we also put together what we call the RQ Plus Trainers Kit, that is a tool or a compilation of materials that can help trainers to use the tool in a sustainable way. We actually recently worked with several partners on preparing a PAHO virtual campus training on RQ Plus. So it is a self-learning course, but it's designed to help trainers to train other people or at city level. So this QR code here takes you to the waiting list for the course. The course will be launched probably by June 5th in the context of the World Environmental Day, World Environment Day. Also, it was developed in cooperation with several partners, the Universidad del Norte, National Institute of Public Health, Universidad de Colorado, WHO, and it has been a joint effort. Currently, we also have cities and countries doing the training like a test cohort to check any improvements. We have HEAT, that is a software tool that helps us to estimate the health impact of active mobility, but also quantify the economic gains and the reduction of greenhouse gases emissions. And that for us is very helpful to, not for us, what we have seen is that for cities is very helpful to use this tool, because it helps, the cities are making important investment in sustainable mobility, in active mobility. So this tool helps them to identify the health gains, and not just to identify the health gain, but also to improve the way how the tool, those interventions are plans, so they can incorporate health consideration and particularly invest on road safety to reduce traffic accidents. And then we have Green UR, that is the one related with green urban areas. Cities are making important investment on this component as well. So we are working with them to estimate the health gains of being in proximity to green urban areas, because what the evidence is showing us is that the benefit of green urban areas are if people is close to those urban areas, and they live in proximity to the urban areas and have accessibility to them, so they will have health gain by reducing premature death and improving mental health. So it's a very important component as well, that is also gaining attention now in the context of reducing heat waves and urban heat. And we have Climate QH that help us to estimate the health co-benefits of greenhouse mitigation strategies. This one is more planned at a national level. So we have, so we have there the example of Colombia, that 2 years ago also developed run an estimate of the benefits of their national determined contribution program. And something that was highlighted over there was that their goals, by incorporating health, they actually increased their mitigation ambitions, and we held them to estimate the health co-benefits of those interventions. Glad that Diana is here as well. We keep talking about the example of Barranquilla as a health-focused city-level planning. We have worked with WHO on implementing the complete set of tools. Barranquilla made important investment on urban renovation and urban planning, building green urban areas. Oh, there is a recording over here. I was looking, what is this? I mean, that pointer over there is not mine. It's like something that is pre-recorded there. Apologies. So we have the river walkway. This is Malecom, more than 5 kilometers of area recover or built besides the river, and it's helping the city it's serving as it's bringing many benefits. It's attracting over 10 million of visitors every year. Is also serving as an opportunity to reduce, to increase physical activity, to promote health promotion activities, as well as economic development. There are like now buildings over there, economic activities in the area, and with the city also have like this program to recover green urban areas. That is, they call it Todos al Parque. That is a program that has been recognized globally and awarded as one of a great example of city level interventions. So by doing this, they also are able to reduce, not just this, but other intervention. The city have reduced PM 2.5 concentration during the last 5 years, have increased health, has set as a strategy to increase physical activity and to develop activities of health promotion. And currently, 93% of the population has access to parks within 5 minutes of walking distance. And of course, the health sector has a crucial role in this conversation, at least in three components: to develop health evidence, to increase primary care, and to do outreach and communication. So the health sector is probably one of the government sector that has more credibility. So it's very important that the health sector can engage in this conversation. But for them to engage, we also and we want to thank you also the academic community on this conversation, because it's very important that the health professionals receive, as part of their learning path, elements to help them to integrate environmental health risk into their actions. Because traditionally, we understand that it has been very focused on a biomedical approach that has left behind the environmental risk factor, but now we are seeing that this is changing, and it's a very important opportunity, because we want to bring the health sector to the table, to the conversation, but we also need to equip them to be able to engage, achieve public health goals on those conversations, and not just being invited to be part of the validators of a specific project process. So just to close, there is plenty of evidence on air pollution, climate change, and health. There is no excuse to wait more. We need to advance, and we need to keep working on this. Air pollution is the leading cause of non-communicable diseases, but it's still a modifying factor. It is crucial to increase intersectorial technical cooperation and to empower the health sectors and key actors to address air pollution, to increase the regional understanding of air quality and climate change and its health impacts. And also to finalize, there is now is the season for the Americas. We saw COP16 last year in Colombia. The second Global Air Pollution Conference happening this year also in Cartagena. Several of you were there, and thank you. And this year we are going to have the COP30 that is happening in Brazil. And there is a conversation over there about integrating air pollution or super pollutant or short-lived climate pollutants as part of mitigation actions. So thank you. Well, it says Unit Chief. Daniel is the Unit Chief and the Climate Change and Air Quality Advisor. Thank you for your time on this conversation. Back to you, Zaman.
Thank you, Juan, Jose, for this great talk. So we'll open it up for questions now. If you have any questions, please type them on the Q&A section of Zoom, or in the chat is fine too. While some questions come, I wanted to ask you if you have any examples of use of these tools, for example, around climate change. Any examples of a city, a good success story where the PAHO's technical collaboration with the city has resulted in some policy change?
Yeah, well, I would say that Barranquilla case is a great example, right?
Yeah.
So, but I also wanted to highlight that this was work that was already being done by the city. So the city was investing in in urban planning and in urban renovation. The city has experienced this transformation. It has partnered with the academia, And now what we did with Barranquilla is that helping to estimate the health gain of those interventions, also the climate benefits. And by doing that, we are currently working with them. So they are increasing their ambition of their interventions, trying that future interventions also can consider this as part of the planning stage. So it's not just something that we see at the end, but it's something that can be fully integrated in the process. And we have also used the tools in Argentina, in certain countries in the Caribbean. Initially, we use it as a assessment, like a rapid assessment to see what are the baseline levels of benefits of the existing intervention. But then what we are seeing is that cities are using this to enhance their planning and interventions.
Okay, thank you. So I have another question that I relates to work around household air pollution, because you kind of listed that when you had the list of different types of threats related to air pollution. And one of the pictures that you actually show, the vulnerable groups, I remember on the bottom left, was a very polluted household. Is it still a big problem in the region?
Yes, and you know, Zama, and I also wanted to ask for the academic community over here, because we still have a way to go to fully identify like equity components of these impacts, right? So because we usually say, well, there are 7 million of deaths attributable to air pollution. There are 320,000 in the Americas. We know the elderly, the people with pre-existence, people living in poorer areas of the cities are more affected, rural areas. And we know that there are differentiated impacts on men and women. However, we are still not monitoring that. We are still not measuring it all the time. So it will be good if we are trying to advance on that. And at least, for instance, on the health impact of air pollution, we are trying to differentiate men and women, even though the exposure and the function that we are currently assessing are the same. Well, when we are talking about mortality, but at least to be able to make visible this, that we are like a design chain in a descriptive way, that we are able to identify, not just for the fact of identifying them, but also so we can develop more tailored policies that can help to reduce the burden of disease with equitable conditions, and also like considering like these interventions, particularly interventions in active mobility, for instance, or in transportations, that we are able to identify what are the populations that could benefit the most for those interventions. So that could be also considered during the planning. And this is a conclusion that Barranquilla made in one of our conversations. They said, yeah, we are doing this, and we can enhance this by, now that we are aware that people with pre-existence are more sensible to heat and air pollution. Probably we need to make sure that there are alert systems for people using medications for they to take prevention measures during heat episodes or higher pollution concentrations. So yeah, it is something that we definitely can advance on.
Okay. Thank you. Thomas, I think you have a question.
Yes, thank you. I thought it's going to be too long to type up in the chat or too complicated. No, I'll try to keep it simple. Thanks for a wonderful presentation, Juan José. I think before I ask you a question, I just want to point out or highlight, I think to the colleagues here, many of which are, enveloped in very, I don't know, sophisticated, data heavy and it analytically very cutting edge type of epidemiological research. But I think Juan José put it very nicely, the role of these health impact assessment tools. On the one side is the numbers that they spit out, but just as much and just as importantly, I think, are the processes that they allow to initiate. You mentioned the stakeholder engagement, the capacity building. We often refer to the HEAT tool as basically a communications tool or just a door opener. You can bring the sides together. So I think that's helpful for us to keep in mind that it's really not so much about the digits behind the numbers, but really kind of the overall communication and I don't know, education capacity of these tools as well. So Juan Jose, you know, WHO or PAHO has played a bit of a double role here when it comes to the development of health impact assessment capacity. Typically, we think of you as kind of like a, I don't know, on the ground organization that disseminates this capacity and engages the cities and the stakeholders, just as you outlined very nicely. But at the same time, you've also been kind of at the forefront of development. AirQ Plus and the HEAT tool have been around for over 10 years, and there's been very innovative efforts from within these organizations, well, the WHO or PAHO organization, to advance this. Where do you see your role mostly? You know, are you investing also in the development and maybe further integration of these tools, or are you seeing yourself mainly as kind of like a recipient of maybe academic work to produce these advancements in the tools? Or do you try to do the splits and be a little bit on both sides? Maybe you can comment on that.
Yeah, thank you, Thomas, and thank you. It's always great working with you and hearing from you. I want to also point out on your first comment, definitely. So there is a moment when you can bring the data, and it's very important to bring the data and to raise awareness and call out the attention about this specific data. But then that part of the process of putting the people together, bringing the expertise and equipping the teams and help them to work together is very fundamental, and it helped them a lot. And also, I mean, it helped us a lot as well. The issue with that is like it's a very lengthy process. So it's quite easy to actually, no, I don't want to say easy, but it's like quite straightforward to use the tool, right? And if you don't have some data, you can bring secondary sources of information and run the tool and do the estimates. And probably there is a moment to do that. But also there is a moment to put together those conversations. But I think both are very important processes, and those initial rapid assessment estimates or doing by the academia are very helpful because it called the attention on why this could be important. And then the city start questioning, but how do you gather that information? And even we have gone through processes that we spend 6 months doing an estimation. Let's call the health sector or the environmental sector or the mobility sector never reply. And at the end of the process, when they see the data, they say, okay, but why you didn't ask us or something like that? But it's very important to create those dynamics. And at PAHO, WHO is the one actually developing the tools. With you, I know that you are part of also the developers of HEAT. We want to make the tools accessible, also useful for the region, and that means that we want to keep working with the developers in the academia first on making. We worked recently on making HEAT available in Spanish, right? That for the case of AirQ Plus, and we need to keep working this on HEAT, was make a huge difference. Even though there is not a lot of text over there, the fact that the tool is available in the spoken language of a specific country makes a huge difference. And also that those tools, because those tools are developed as like a global goods, right? So it's also important to try to incorporate some components for specific regions. And if we are able to gather some information and have it preloaded in the tools that are helpful for the cities, that could be great as well. And of course, the component of capacity building, that is something that we are really engaged, invested. We want the cities and the final users to be able to do the tools, because there is not a sustainable way. What we have found out is in the past, probably what we did is like, we still do some of that. Like we do a training, people get excited, they try to use it, but then you don't have the training available any longer, so you cannot bring continuity. And even if you do that, during the next year, there is a new team in the city governance team, so you need to redo the process. So what we are trying to do is like building this group of experts that it includes people from the academia, from the government, and civil society organizations, so we can bring more sustainability to the process. Thank you, Thomas.
Thank you. I have a question here on the Q&A from Daniel Rodriguez from our team in Berkeley. He says, very interesting, Juan José, thank you. Do you have a sense, and this is related actually to what you just answered, do you have a sense what may be some of the determinants of city interest in using these tools to inform their upstream policymaking? See, in Barranquilla, it seems like city size does not appear to be a strong determinant. Is it elected official interest, technical staff interest, other things? So what matters in whether cities are using these tools?
No, that's a great question, Daniel. We traditionally focus, I mean, we have, of course, the works in mega cities cities of more than 7 million inhabitants, that we have a few in the Americas. They are like receptors of several technical cooperation. We have been trying to pitch this also to mid-sized cities over 500,000 inhabitants that we understand have the capacities to, they already have like an environmental department and secretary of health and some other kind of organization that allow them to gather some information, and it's not just depending on one person. So probably 1 million is a number where cities have that, but also 500,000 is something that we think it works. What we are seeing also is like, we have tried both ways, right? Like where there is an existing political leadership and interest, like Barranquilla. Barranquilla actually traveled to the World Urban Forum in Polonia a few years ago, and over there they heard about the tools and they wanted to do it. They were working on that, and we just respond to a request for technical cooperation. And also, what we are trying to do is fostering articulation with climate change policies and funding. So we are trying to if the country has a commitment or the city has an opportunity to advance climate change action, we try to use these tools as a way to engage other areas. What we are seeing is like the air quality teams or the environmental teams and the mobility teams are like people who are interested in using this. So heat is currently a tool that is gaining a lot of attention, and we are still building our capacity to deliver consistent technical cooperation on the use of the tool. RQ Plus is, I mean, traditionally the one that we are using the most, and Green UR is managed. So green urban areas in a city could be either with planning or with the Department of Beautification and Arborization. So we don't have a direct channel with them all the time. So that is the one that is taking us more effort to use. But I will say that before we also have similar issues with heat, because we have the channel with the mobility planning teams, but now we have that component. And Daniel, I think also the interest of technical teams is really good, and we need to share like these success stories. If we are able to, we have been investing in developing infographics and case of studies and telling the stories, so other technical teams can gain interest and see that this is something that they can use. So it could be like a high political level commitment that they wanted to do it, and they want to showcase the benefits of the interest of technical teams, building upon successful experiences, or funding coming from a third party. This one is a little bit more difficult when that happens, to engage with the teams, but I will say that either going through the technical teams or high political level will be is great.
Thank you. And we have another question from Mariana Lasso from our team at Drexel. She says, thank you for the great presentation. My question is about whether and how the tools that WHO and PAHO has developed to identify best buy practices to address air quality issues incorporate costs, economic costs. And she says that policymakers have identified that cost is one of the most important factors that drive policy.
Yeah, no, absolutely. probably Thomas can comment also something on heat, but heat includes the economic assessment, and it's very important. It's very important because we know that health, and this is a request, and I can see in the short term or mid term, having like an economic assessment tool incorporated either within the tools or as a separate tool, because this is the natural next step or next request from the countries. Because from the health perspective, it's usually enough just to say you are saving life and you are reducing morbidity and mortality. But when you are doing an investment project, you need the numbers. I mean, you need the economic evaluation. And of course, the economic valuation techniques have some uncertainties and some discussions that need to be held. We are more than willing to do it. Barranquilla did some of this work. Climate QH in Colombia also includes some economic estimates. And when the estimates are there, they use it, people use it, cities use it, country use it. So it's definitely something that can be done and needs to be done. We currently, when it's not incorporated within the tool, we are complementing the assessment with value of a statistical life, losses, productivity, and we try to bring economists to the team so we can complete that part of the assessment. So yep, definitely this is something to be developed. I know that there is a lot of conversation over there and discussions, but that is something that it is advancing. So probably the tools, the first two are not coming from WHO, but the needs is there and people is trying to address it.
Thank you. So and then one last question from Astrid Herrera from our team at Colombia. Thank you, Juan José, for the presentation on this on environmental quality tools. In the medium term, have you considered including a module that includes validation of data in relationship with the temporal and geographic representativity of the data, and also a module to include air pollutant mixtures?
Yes. No, that's great. And I'm probably coming back to the question on Thomas on the development and what will be next. So all this could be considered as part of the tools. The not issue, but something that we need to take into consideration is that these are planned as global public goods. So it cannot be overcomplicated because it should work on the least developed countries and cities as well as the most developed countries. Even though what we are seeing, like most developed cities and countries, they are using like their own tools and their own methodologies and techniques. So yes, we have seen, for instance, when we were working on climate QH, we used climate QH in Argentina and Colombia. And as part of the process, some small changes to the tools were incorporated. RQ Plus is also the result of an improvement of the RQ tool. So yes, the tools can be improved, and WHO health consultation on what can be included, and they usually try to advance on that and do consultancy on that. Many of you have probably participated on the development of these tools and know about some of these plans.
Thank you. Thank you so much. And thank you for your presentation and for spending this hour with us. So please, everyone, a round of
Thank you.
applause for Juan José. Just as a reminder, everyone will be having the CCUH pre-symposium on September 3rd. If you want to register, I'm putting the link on the chat here. September 3rd of this year, Climate Change and Urban Health, a focus on the future. It's either in person or remote. You can have many, can join either way, and it's going to be free. And it precedes the following 2 days by the Urban Health Symposium, which you can find on the same website about the information about it. So thank you, everyone, and see you next academic year with our new activities. And thank you again, Juan José, for your presentation.
Thank you so much. Have a good one. Thank you all. Bye-bye.